This video discusses what Obamacare will mean to the individual, especially those currently uninsured. The Patient Protection and Affordable Care Act, known by its nickname Obamacare, was signed into law by President Obama in 2010, and although opposed by some in government, it has stood the test of a Supreme Court challenge. Many of its new laws take full effect on January 1, 2014, but some of its mandates have been officially postponed for another year after that date. Whether those stipulations will ever be fully realized and what form they will take are unknown, but we do know that health insurance reform, the stated intent of Obamacare, is being implemented now and should provide many benefits for individuals who have no health insurance today. Why was Obamacare enacted? Well, here are a few statistics. In 2010, nearly 49 million Americans, almost 20% of our population, had no health insurance coverage or inadequate access to medical care. Almost 60% of our population have delayed or simply decided not to seek medical care or health insurance because it was just too expensive. Almost 25% of workers who are offered health insurance through their employers turn it down because it costs too much. If any of this sounds like your own situation, you are not alone. Obamacare is primarily designed around the needs of individuals who, for whatever reason, are currently living without health insurance. Let's take a look at the most common reasons that people remain uninsured and how Obamacare aims to resolve these issues. There are many people who are uninsured because they have a chronic or a pre-existing condition, and so they either cannot get coverage at all, or the coverage they need is so expensive they can't afford it. Obamacare addresses this need by prohibiting insurance companies from overcharging individuals who have chronic health issues, and from refusing to cover individuals because of pre-existing conditions. There are some without coverage who are people who for one reason or another have lost their state or federally subsidized health coverage. Under Obamacare, these individuals can now qualify for a standard and complete health care plan. The most common reason that people don't have health insurance today is because it's too expensive. Small businesses constitute 72% of the American economy, and they provide nearly 90% of the jobs. But many small businesses operate on narrow profit margins, and as such, simply cannot afford to provide group health plans to their employees today. As noted above, many people who are offered coverage through their employers have opted not to participate in the healthcare benefits at work because they cost too much. Obamacare addresses this situation in several ways. First, for those who are not offered group health coverage at work, Obama creates the Individual Healthcare Exchange, an online service where individuals and families can shop for and purchase healthcare coverage. For those with low income, there is a federal subsidy offered through the individual exchanges that aims to make healthcare affordable for everyone. For example, if your individual or family income ranges from 135% to 400% of the established federal poverty level for your category, you qualify for a subsidy on the exchange. And at the lowest levels of income, that subsidy could be as much as 100%. Any individual at any income level can purchase coverage through the exchange, but the enrollment process is challenging and confusing at best. It's wise to consult an experienced healthcare insurance professional who is fully trained in the many aspects of healthcare reform for help in navigating the nearly 65 pages of questions and required personal information that are involved in online enrollment on the exchange. Obamacare also creates the Small Business Health Options Program, an exchange designed specifically for small employers. It is abbreviated the SHOP or SHOP exchange. This online service creates a marketplace for small employers to find suitable and affordable group healthcare plans designed specifically for them. Small employers who purchase coverage through the SHOP exchange can qualify for federal tax credits to help offset the costs of this coverage. Again, for the small business owner, it's not wise to try to navigate the SHOP exchange enrollment process without the help of a competent, experienced health insurance professional. At Cornerstone Financial Group, we have invested the time in training our representatives to be the real experts in healthcare reform. As an individual, you will need help. As Obamacare is rolled out across the country, new laws, rules, and guidelines are being constantly published and revised. We make it a point to keep up to date on these changes, and we make them available to the public in our free monthly newsletter, Healthcare Reform Review. You can subscribe to this newsletter by clicking the Subscribe Now link at the right. There is no charge for this service, and your contact information is always confidential. It will never be shared with anyone. Thank you for watching this video, and we look forward to helping you and your family with your health coverage needs.